In this podcast episode, Andrew Huberman engages in a discussion with Dr. John Kruse, a leading expert in ADHD treatment. They delve into various aspects of ADHD, including its definition, symptoms, treatment options, and the interplay between behavioral tools and medication. Dr. Kruse begins by clarifying what ADHD is, emphasizing that it is not merely a childhood disorder, but one that can persist into adulthood. ADHD is characterized by a combination of symptoms that fall into two main categories: hyperactivity-impulsivity and inattention. The diagnostic criteria include 18 symptoms, with adults needing to exhibit at least 5 to qualify for a diagnosis. Dr. Kruse highlights that while many people may display these behaviors occasionally, those with ADHD experience them to a degree that causes significant dysfunction in multiple areas of life, such as work, relationships, and daily activities. The stigma surrounding ADHD often leads to misconceptions about its legitimacy as a diagnosis. Dr. Kruse points out that unlike conditions such as schizophrenia, which have clear and observable symptoms like hallucinations, ADHD symptoms are common behaviors that can be misinterpreted as normal. This misunderstanding can lead to skepticism about the diagnosis, making it crucial for individuals to understand the complexities of ADHD and its impact on daily functioning. The discussion shifts to the influence of environmental factors on ADHD symptoms. Dr. Kruse notes that the home environment, especially during the COVID-19 pandemic, has changed significantly, affecting how individuals with ADHD manage their symptoms. With many people working from home, the lack of structure and external accountability can exacerbate attention difficulties. In contrast, structured environments like schools or workplaces provide a framework that can help individuals with ADHD focus better. Dr. Kruse explains that the ADHD brain often struggles with executive functions, which include working memory, impulse control, and emotional regulation. This means that individuals with ADHD may rely heavily on external structures to help them manage their time and tasks effectively. The absence of such structures at home can lead to increased distractibility and difficulty in completing tasks, highlighting the importance of creating an environment conducive to focus and productivity. The conversation naturally transitions to medication, where Dr. Kruse discusses various pharmacological treatments for ADHD. He explains that stimulant medications, such as Adderall and Ritalin, are the most commonly prescribed and effective treatments. These medications work by increasing the availability of dopamine and norepinephrine in the brain, which helps improve focus and attention. However, Dr. Kruse emphasizes that these medications are not a one-size-fits-all solution and that individual responses can vary significantly. Dr. Kruse also addresses concerns about the potential for addiction to stimulant medications. He reassures listeners that while there is a risk, particularly for individuals with a history of substance abuse, the benefits often outweigh the risks when these medications are used appropriately. He highlights the importance of thorough evaluations and ongoing monitoring to ensure that patients receive the most effective treatment while minimizing potential side effects. In addition to medication, Dr. Kruse emphasizes the importance of behavioral tools in managing ADHD symptoms. Cognitive behavioral therapy, CBT, is one such approach that has shown promise in helping individuals with ADHD develop better organizational skills and coping strategies. Dr. Kruse explains that CBT focuses on changing thought patterns and behaviors, which can lead to improved emotional regulation and reduced impulsivity. He also discusses the significance of establishing routines and structures in daily life. For individuals with ADHD, having a consistent schedule can help mitigate the chaos that often accompanies their symptoms. Dr. Kruse encourages listeners to prioritize sleep, nutrition, and exercise as foundational elements that support overall well-being and can enhance the effectiveness of both medication and behavioral interventions. Dr. Kruse highlights the critical role of sleep in managing ADHD symptoms. He explains that individuals with ADHD often experience sleep disturbances, which can exacerbate attention and focus issues during the day. Establishing a regular sleep schedule is essential for optimizing cognitive function and emotional regulation. Dr. Kruse suggests that individuals with ADHD should aim for consistent sleep and wake times, as well as create a sleep-friendly environment. Moreover, he He discusses the importance of sleep quality, noting that it is not just about the number of hours slept, but also the timing and restorative nature of that sleep. Dr. Kruse encourages listeners to be mindful of their sleep hygiene practices, such as limiting screen time before bed and creating a calming bedtime routine to improve overall sleep quality and, consequently, attention and focus during the day. The conversation then shifts to the impact of nutrition on ADHD symptoms. Dr. Kruse emphasizes that a balanced diet plays a crucial role in brain health and can influence attention and focus. He discusses the importance of regular meal times and the potential benefits of omega-3 fatty acids, particularly EPA, found in fish oil, for improving ADHD symptoms. Research has shown that omega-3 supplementation can have positive effects on mood and cognitive function, making it a valuable addition to the treatment plan for individuals with ADHD. Dr. Kruse also highlights the need for individuals with ADHD to be aware of their eating habits, as many may forget to eat or skip meals due to their distractibility. Establishing a routine around meals and ensuring that nutritious options are readily available can help support better focus and overall well-being. Dr. Kruse discusses the benefits of exercise for individuals with ADHD, noting that physical activity can help improve attention, focus, and mood. He explains that exercise increases the release of neurotransmitters like dopamine and norepinephrine, which are essential for regulating attention and motivation. Regular physical activity can also help reduce impulsivity and hyperactivity, making it a valuable tool in managing ADHD symptoms. He advises listeners to find an exercise routine that works for them, whether it's running, swimming, or participating in team sports. The key is to engage in activities that are enjoyable and sustainable, as this will increase the likelihood of sticking with the routine. Dr. Kruse emphasizes that exercise should be viewed as a complementary approach to medication and behavioral interventions, rather than a replacement. The discussion also touches on the role of caffeine in managing ADHD symptoms. Dr. Kruse explains that caffeine can have both positive and negative effects on individuals with ADHD. While it may help improve focus and alertness for some, excessive caffeine consumption can lead to increased anxiety and jitteriness, which can exacerbate ADHD symptoms. He encourages listeners to be mindful of their caffeine intake and to consider how it affects their attention and focus. Dr. Kruse suggests that individuals with ADHD should experiment with their caffeine consumption to find the right balance that works for them, taking into account factors such as timing and dosage. Dr. Kruse discusses the potential effects of nicotine on ADHD symptoms, noting that some individuals may find it helpful for improving focus and attention. He explains that nicotine acts as a stimulant and can enhance cognitive function, making it appealing to some people with ADHD. However, he cautions against the risks associated with nicotine use, particularly in the form of smoking or vaping, which can have detrimental health effects. He emphasizes the importance of considering the long-term consequences of nicotine use and encourages individuals to explore safer alternatives for managing their ADHD symptoms. Dr. Kruse suggests that individuals should weigh the potential benefits of nicotine against the risks and make informed decisions about its use. The podcast also delves into the emerging research on the gut-brain connection and its implications for ADHD. Dr. Kruse explains that the gut microbiome plays a significant role in overall health, including mental health. He discusses how imbalances in gut bacteria can influence mood and cognitive function, potentially impacting ADHD symptoms. Dr. Kruse encourages listeners to pay attention to their diet and consider incorporating probiotics and prebiotics to support gut health. He emphasizes that a healthy gut microbiome may contribute to better focus and attention, making it an important area of exploration for individuals with ADHD. As the conversation wraps up, Dr. Kruse reflects on the future of ADHD research and treatment. He expresses optimism about the growing understanding of ADHD and the development of new treatment options. Dr. Kruse highlights the importance of continued research into the neurobiology of ADHD, as well as the exploration of innovative behavioral interventions and pharmacological treatments. He encourages listeners to stay informed about the latest developments in ADHD research and to advocate for themselves or their loved ones in seeking effective treatment options. Dr. Kruse emphasizes that with the right combination of behavioral tools and medication, individuals with ADHD can lead fulfilling and productive lives.